St. Paul's Ask an Expert series is a free educational program featuring knowledgeable presenters from our community discussing meaningful topics of interest for older adults and their families.
Hello, I'm Rita Clementi. I'm the Vice President of Community Relations for St. Paul's Senior Living Community in Greenville, Pennsylvania. And I'm joined today by...
My name is Michelle O'Malley. I'm the Client and Staff Development Coordinator for St. Paul's Without Walls Home-Based Services here at St. Paul's Senior Living Community.
So we thank you for joining us today. Our topic today is care at home. And so Michelle and I are going to talk first a little bit about private duty home care, which is a service that we provide through St. Paul's Without Walls. We will also have guests who will speak about home health care, which is the skilled or professional side of help at home, and also hospice care. All of these are services that enable individuals to remain in your home, receiving the support that you need. So again, thank you for joining us. Just a little bit about St. Paul's Without Walls from my perspective. We are a private duty home care agency. Home and community-based services is the term that is formally used. We offer care to individuals who employ us to assist them in their homes in a variety of ways. We were established 10 years ago. This October, we'll be celebrating our 10th anniversary, and very pleased to have the opportunity to serve so many individuals and their families in their home. So Michelle, tell us a little bit about the services that we provide.
There are basically two levels of care that we offer: companion level care and care partner care. Companion level care includes support services such as light housekeeping, maybe a ride to the doctor's office. Maybe it's just companionship and socialization. That engagement is so important and helps break up perhaps a person's day and add quality to their life. The care partner level care partners provide all of those kinds of supportive services that I mentioned. In addition, though, someone might need help with bathing, dressing, toileting, ambulation, and or meal preparation.
Great. We also offer some assistance, reminders with medications and assistance with grooming. So I like to say anything that you or I do throughout the course of a day that someone needs help with, I think is what our caregivers and companions offer. We have other services that we provide as well.
We do. We have Lifeline, personal help buttons. We also have medication dispensers. We also offer a on-the-go dining program. It's a hot meal delivered daily to your home if you live within a 5-mile radius of campus here in Greenville. And then we also offer the opportunity to purchase medical supplies and medical equipment through St. Paul's. We can sometimes offer a more competitive price since we buy in volume here on campus. And so basically those are the 5 levels of service, levels of support: companion, care partner, Lifeline, personal help buttons and medication dispensers, on-the-go dining, and medical supplies.
So we mentioned a little bit earlier that our services are private duty, and they are for the most part covered by private funds. Individuals pay privately an hourly rate for care partner and companion. And the only other benefits that we work with would be long-term care companies for individuals who have long-term care and who meet the criteria of that policy in order to receive care in their home. And we are also a licensed provider for the aging waiver, which is now the community health choices through the Office of Long-Term Living here in the state of Pennsylvania. Those would be for individuals who have limited income and limited resources. Happy to provide those services. I would say that the fees that folks pay are really dependent upon the frequency and the duration of the services that we offer. And I would welcome anyone to reach out. Michelle handles our inquiries. You can call her, learn a little bit more about the services and what we have to offer, and she'd be happy to give you an idea of what those services would cost, and you can talk about how those services would be paid for. I would just like to share that the pandemic has certainly taken its toll on healthcare in general, but for us, it does mean that there's a much greater need out there in the community than what our staff can provide. And oftentimes today we find ourselves having to say no to an inquiry because we just don't have the capacity in our staff. So I'm just going to put a call out there. If anyone is interested in learning a little bit more about St. Paul's Without Walls and what a care partner or a companion does and what the benefits of serving in that capacity are, we would welcome a phone call, and we would like for you to explore the possibility of working here. More and more folks are choosing to stay in their homes, and we just need good, compassionate, caring, honest, trustworthy people to come and be a part of our Without Walls team. So please contact us and explore the possibility. As far as reaching out to us, you can find information about St. Paul's Without Walls on our website. Our site is www.stpauls, so STPAULS 1867.org. And you can query Without Walls on that site. You can also call our office at 724-589-4740. We hope that you'll take the opportunity to explore our services and our employment opportunities. Thank you. Hello, I'm Rita Clementi. I'm the Vice President of Community Relations at St. Paul's Senior Living Community. And my guest here today is Tim Dunn. Tim is the Executive Director of VNA Alliance Home Health Agency. And they're actually located in Meadville, but you serve a broader area than Meadville, don't you?
That's right, Rita.
Tell me a little bit about your service area.
Well, the VNA Alliance, we're based out of Meadville. We are a Medicare, community-based nonprofit home health agency, but we do service Crawford, Mercer County. We go into Venango County. We also service Northern Lawrence and Northern Butler counties, and we'll go into a little bit of Southern Erie County as well.
That's a much bigger area than I ever knew of, so congratulations. And I know that you've grown. When were you established?
We were established in 2008, so we're coming up on 13 years.
Wow, that's terrific.
Mm-hmm.
That's terrific. And St. Paul's is one of 5 partners?
There are four
Okay.
primary partners that we have, and you're absolutely right. St. Paul's is one of the founding partners that we have. We are a company that was formed by Meadville Medical Center in Meadville, and as well as Westbury Retirement Community. St. Paul's is a partner of ours, and our managing partner is out of Butler, Concordia Community Support Services. Those are our primary partners.
That's great. I do know that here on our campus of St. Paul's, you provide services to a number of our residents, and we're very grateful for that. It certainly helps them to remain independent and strong in their homes. So we're grateful for that, as well as all of those communities that you serve. And it's a nice part of our continuum of care. So we're very appreciative of you and your team. So tell us a little bit about home health care. What kinds of services that you provide? What disciplines actually provide those services? And how does someone qualify for those services?
Absolutely. Home health care is established for those who cannot traditionally seek their service through those normal venues, outpatient services, clinics. So it was designed for those that have trouble accessing community. So to qualify for home health services, there's a couple of things that we need to have. We have to have a skilled need. So the services we provide incorporate nursing care, a variety of therapy services, PT, OT, and speech, medical social services, home health aides. And so those services provide a skilled intervention. So it would take that individual to help intervene and direct and guide through an issue of illness or injury. And so the patient during this time in an intermittent fashion is confined to home. And that's because of these conditions, illnesses, or injuries that would require these disciplines, these professional clinicians to come to your home and help you out. Also, those services or those conditions may make it difficult to get out, and so departures don't happen as often, and maybe they're of shorter duration. So that's typically the type of patient that we would see. There must be a skilled intervention for those specific needs from a profession, and those are given on an intermittent basis. Typically, the patients we see in home health, and we have over 500 patients right now that we're caring for across that service area. Typically, we would see them up to maybe a couple months, maybe 20% of them we might even see longer for chronic issues or conditions. Our staff then would, under the direction of a physician or a nurse practitioner, physician assistant, they could orchestrate and order these cares to be delivered into the home. And we would see someone perhaps maybe a few weeks if it's a very uncomplicated orthopedic procedure, or maybe someone's dealing with a chronic neurological case or maybe a chronic disease, and those services might keep our team on board for a little bit longer, up to 40, 50 days on average.
Oh, that's terrific.
Mm-hmm.
So how would I go about securing your services if I'm perhaps planning a joint replacement and my doctor is saying that I'm going to go back home after that replacement, and I don't really feel like I'm going to be capable of regaining strength on my own, and I'd really like to secure the services, and perhaps my doctor's willing to work with me on that.
Mm-hmm. Well, absolutely. So the physician it's a physician-driven program in the home health service line. So if you would articulate that to your doctor, I would really like some help. Typically, they're already collecting information leading up to that type of procedure. What type of home environment do you have? What type of support systems are in play? And services like ours, VNA Alliance, could be ordered to come in quickly after those discharges back home, so we can help you stay safe. And what I like to say is age in place. We want to be successful in the home environment. We don't want to have to go to higher levels of care. Let's try to receive our rehab and our nursing care in our living room, if that is at all possible.
And how are those services paid for? Do I pay privately?
Yeah, most of the care that we provide is covered under insurance. So we have a variety of contracts, certainly Medicare, UPMC, Highmark insurances, Gateway, Humana. So there's multiple options out there that provide coverage for home health services. And that's an easy question to see. Give us a call at the office to see if your particular insurance is covered. And the nice thing about the home health world is under that Part A benefits, there is no copay for that. So it is a nice service that is completely covered by your insurance, and the physician is in charge of that plan, so we can stay in close communication on your progress.
So when you say Part A, that's a service that you're providing in my home. What distinguishes a Part A service?
Yeah, so for Medicare, there's a Part A and a Part B. Part B covers outpatient services.
Okay.
And so with outpatient, you could go to a clinic. VNA Alliance, actually, we are in the process and partnership with St. Paul's to be able to provide some of these services on campus, and we're excited to be working towards that goal. But right now, the Part A, you have to meet that specific criteria. You have to have the skilled need has been defined, and there has to be a homebound criteria that is satisfied.
Okay, terrific. So I know I've often heard about folks going into the hospital and they want to make sure that they are able to use the services of a company that they choose.
That's right. It's really important because home health can be fairly generic. You could be in a facility and they may ask, oh, we're going to set you up with home care. And you might be thinking from experience, oh, that means VNA. And that may not necessarily be. So you want to make sure you specify, hey, I really would like to go home with the VNA Alliance because that's the service I trust. I know I'll get great outcomes. Otherwise, you might end up with another home health agency, but it may not be the quality that you're looking for.
Sure. And I know that's important to our residents because VNA is a part of our continuum of care, and they want to make certain that they can, connect with those services when they need them at home.
And that's really the great thing about our relationship here because we are so invested with St. Paul's and the staff here. We meet regularly with the leadership, and so if there's any type of issues between the coordination of care, the implementation of care, we can certainly get a resolution quickly. Reaching out or utilizing services outside of that preferred partnership, not that you can't, but we leave out some of that efficiency that we've established over our years as preferred partners.
Sure. So I appreciate all of the information. Is there anything else that you feel is really important for us to know?
Yeah, really, home health is a growing industry, and we certainly want individuals to live the highest quality of life as possible. And so our team of professional clinicians, nurses, and therapists are here. They love what they do. They enjoy being a guest in your home and taking care of you, and they'll do it in a safe and effective manner.
So if I want to call VNA Alliance Home Health, how do I reach you?
Yeah, we actually, you can find us at 814-333-7000. We're in the old Days Inn Meadville.
Oh, that's right.
Yeah, the Days Inn old hotel. Westbury had purchased that property and has made a beautiful renovation. And so we are in the front space of that new section there on the Conneaut Lake Road.
I also understand you have a very robust website.
Yes, you can find us there at VNAalliance.org. So go ahead and check us out online. And we're on Facebook too.
Great. Tim, I really appreciate you taking the time today, sharing with us. Our hope for today is just talking about care at home, whether it's home care through St. Paul's Without Walls, home health care through VNA Alliance, and we'll also be talking about hospice care. It's just really important that folks know that there are services available to them, allowing them to stay in their home and receive the services that they need and want.
Absolutely.
So thank you very much for being here.
Thanks for having me.
Hi, I'm Michelle O'Malley, Client and Staff Development Coordinator for St. Paul's Without Walls Home-Based Services here at St. Paul's Senior Living Community in Greenville, Pennsylvania. I am joined by Amanda Diodati Everly from Kindred Hospice. Welcome, Amanda.
Hi, thank you for having me.
It's a pleasure. Today we're going to talk about various levels of care. Amanda's going to speak on hospice care, Kindred Hospice out of Meadville. Amanda, could you tell us a little bit about your organization?
Sure. I am from Kindred Hospice, and we are part of Kindred at Home, which has the pleasure of now being newly acquired by Humana, which makes us the largest hospice organization in the country, with hospice organizations throughout the country giving us the availability to care for patients wherever they call home when they're facing a life-limiting illness.
I think sometimes there's a mystique or a misunderstanding about what hospice care actually is, and what qualifies an individual for needing hospice level care. Could you tell us a little bit about eligibility and what is, what a client or a patient might be needing from hospice?
Absolutely. So I agree. It is all very overwhelming, kind of trying to find out, does my mom need this? Does my dad need that? Really, it comes down to, what is the physician saying? Is he saying that mom or dad or your loved one is to a point where their illness is no longer curable or no longer manageable? And with that, they're saying that this disease will progress to taking their life. If that is the case, or if your loved one has decided to forego or stop any aggressive or curative treatments, they are aware that that means that that illness will continue, ultimately leading in their passing. With that being said, anyone who you think of that might have that type of situation could qualify for hospice.
So you mentioned the physician involvement, the process for securing hospice services. What does that process look like?
A traditional way to acquire hospice services is by working closely with your care provider. We work very closely with a physician in the community that patient is going to. What they do is give us what they call a referral, and that is when they have identified, after talking with a family and a patient, that they could be eligible for hospice. From there, they send us information, basically giving us a picture on paper of what that patient is going through. From there, we get a doctor's order saying that they would like us to evaluate the individual for hospice care. From then, someone from our agency, we have clinical liaisons that reach out to make contact with the patient and family to set up a time, meet with them, discuss our services, evaluate for services, and then, if based on the information we're seeing in reality and the information we're seeing on paper, show a picture of a true decline and that patient is still wanting that comfort care and quality of life versus quantity of life, then we admit them to hospice services to start care that day.
Very good. So the services, it's decided upon by the patient themselves, the family, the physician, all of that comes together. What services does Kindred Hospice offer? You mentioned the clinical specialist who comes, your role as a social worker. What other services are provided through hospice?
So with our hospice care services, we focus on the person as a whole. So not only are you getting a nurse who will be the case manager, who is an RN, that will oversee the physical aspect of a patient's care, they get an aide to assist with any activities of daily living in the home, as well as myself, who focuses on psychosocial needs of the patient and the family, and then a minister who also focuses on the spiritual side of things. Then we also provide with the patient as needed medical equipment, hygiene items, and then any necessary medications that are contributing to managing symptoms, pain, and the illness of which that individual is on hospice for. Hospice will take care of all those medications as well.
Good. So that is a lot to absorb, and there's so much support that you really do care for the person as a whole.
Yes, yes, absolutely.
Person. How are your services paid for? How does one cover the cost, so to speak?
So we work with any individual who is 18 years or older, and we take health insurance, which could be PPO plans or privately paid for insurance plans, Medicaid plans, and Medicare plans for those who are disabled or above the age of 65. We work with them directly to secure payment. And then for those individuals who might not be able to secure any type of funds for private pay or insurance coverage for the hospice, we have a Grace Foundation, which is our charity that will take on that case pro bono. So we don't turn anyone away for inability to pay. We really feel strongly that everyone deserves the right to have comfort and care and compassion at end of life.
Oh, very good. You explained that very clearly, and I appreciate
Thank
all
you.
the clarification. How does one get in touch with your agency?
So we have a website if you are computer savvy, and it is www.kindredhospicecare.com, or you can call my office directly at 814-336-4660 and just let them know that you have questions about hospice services for your loved one.
Very good, Amanda. Thank you so much.
You're
for
welcome.
joining
Thank you
us.
for your time.
Appreciate it.
So we thank you for joining us for yet another virtual installment of Ask an Expert. We hope that you've enjoyed our speakers and perhaps you know a little bit more about care at home options for you or for a loved one.
We welcome any questions you might have, or if you would like to learn more about home health, home-based services, or hospice care, you can reach us directly by calling our office at 724-589-4740, and we'll answer your question or direct you to the appropriate agency. Thanks for joining us.